Conference Committee reports. Message from the Senate. Mr. Speaker, I hereby announce that the Senate has concurred and adopted the report of the Conference Committee on Senate File Number 1458, an act relating to state government establishing the Health and Human Services budget. The Senate has repassed said bill in accordance with the recommendations report of the Conference Committee of the Senate file herewith transmitted. The Conference Committee report is addressed to the Honorable Sandra L. Pappas, President of the Senate, the Honorable Kurt L. Doudt, Speaker of the House. We, the undersigned conferees for Senate File Number 1458, report that we have agreed upon the items in dispute and recommend as follows. And the Conference Committee report is signed by all 5 conferees on the part of the Senate and all 5 conferees on the part of the House. Dean M. moves that the report of the Conference Committee on Senate File Number 1458 be adopted and that the bill be repassed as amended by the Conference Committee.
Mr. Speaker,
For what purposes does the gentleman rise?
I move that we lift the call of the House.
The motion has been made by Leader Thissen to remove the call of the House. All in favor say aye. Opposed? Motion prevails. I recognize the author of the report, the gentleman from Washington, Representative, the Chairman of the Health and Human Services Committee, Representative Dean M.
Thank you, Mr. Speaker and members. This is the Health and Human Services Bill. I'd like to thank the House conferees Tara Mack, Joe McDonald, Joe Schomacker, Nick Zerwas, and Senate conferees Tony Laurie, Kathy Sharon, Jeff Hayden, Melissa Franzen, Julie Rosen. I'd like to thank the nonpartisan staff, Randy Chun, Jamie Olson, Danielle Pinelli, Lynn Aves, Doug Berg, and our partisan staff, Chelsea Whitman, Heather Kurzbaum, Leah Montgomery, Rachel Stuckey, and particularly and especially for the staff, the revisor's office, and all the folks who put together this bill so very, very quickly. You have no idea how much time it takes to put together in both for the conference committee and for the bill itself. So I would hope that the people who did that were sleeping, but they're probably still working, doing other stuff. So if you can hear this, thank you also very much for all the extra work that you did. We have a bill before us that is different from the one that left the floor in several ways. It is a bill that is about $302 million under base. It does several really good things for health care in Minnesota, for taking care of folks. There's nothing that our health committee does, the people that do the work, that is bad stuff. It's all good stuff. It takes care of people across the state of Minnesota. This bill does some really good things, particularly for our most vulnerable Minnesotans, for the elderly, the frail, and the disabled. It does some things to make things a little bit fairer for Minnesotans across geographies and systems, for patients, providers, and payers as well. We have both caucuses have caucused this bill. It's a very large bill. It's very comprehensive. Rather than go through the many changes and specific points, I think what I'll do in the interest of time and the fact that many of us are probably working on a third night with very little sleep is I will go to questions.
Discussion. Representative Hillstrom.
Thank you, Mr. Speaker. Representative Dean, can you tell me what is the difference between your bill before it left the floor and what it is now?
Is Representative Hillstrom asking Chairman Dean M. to yield?
I am, Mr. Speaker.
He will yield. Representative Dean M.
Thank you, Mr. Speaker. Representative Hillstrom, I can tell you that there are many differences between the two bills that you have, the one that you have before you and the one that left. Some of those differences deal with program. The major difference from a programmatic standpoint is that we had proposed combining MNsure and Minnesota Care in order to streamline those two programs and in order to create a sustainable program long term. I can tell you that I, for one, would have liked to have gone further and done more to create a more sustainable program that looks out further. However, we did listen to the Senate and many other folks who wanted to go slower with that. That is, retains the Minnesota Care program, as I know that it has been an interest for a lot of folks and how that exactly works. We've had a discussion about that, also about the MNsure program moving forward. That's the largest programmatic change. There is also a lot of very good changes, I think, with the child protection, with the work that Representative Crecia has done within that work. Also, we have incorporated several changes that really aim to make things a little bit fairer for Greater Minnesota. Also improving dental access for Greater Minnesota, for adding additional Medicaid reimbursements for the systems across the state of Minnesota, particularly in Greater Minnesota, to make those work a little bit better, to get some more money outstate. Also some mental health incentives that we have to get mobile crisis teams, also additional beds in our mental health systems, which I think is going to be a big improvement. And I think as you hear from the advocates across the state, you'll hear that they will agree with us on that. The 5% campaign is another disappointment that I had and that many of the conferees had from our side, that we were not able to do that and incorporate that with the Senate in order to move forward with that particular thing. That is although we were able to do a lot of really good things for disabled folks across the state of Minnesota and the people who care for them, we were not able to accomplish that with the Senate. And that is work yet to be done. But I was also very proud of the work that was done by the conferees and by the members, by both parties in the House, to do things to help the disabled folks, particularly with durable medical equipment for disabled kids across the state, as well as for additional help in reaching those kids in critical access areas. So those are some of the program areas. From some of the spending areas, we are spending more money in this bill than the one that left the House before. We had not been able to come to an agreement with the Senate and others about being able to save some money with how we are tracking our enrollment. As you know, we had a big debate within the House about whether or not we could actually project savings by going through our programs to see who is on our programs that shouldn't be there, looking at other states and trying to have enhanced eligibility verification. Although we were able to get the Senate to agree to modest reforms within that area and actually book some savings, we were not able to be as comprehensive as we like, perhaps particularly with outside vendors doing the eligibility verifications to make sure that we are able to catch those dollars before they go out the door. So that's another area where we were not able to probably go as far as many of us on this side of the aisle would have liked to have gone. But those are some of the differences, both in program and in money. Those are the major ones that I can think of. Representative Hillstrom.
The lady from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker. Will Representative Dean yield to another question?
The gentleman will yield. Representative Hillstrom.
Thank you, Mr. Speaker. Representative Dean, I was very concerned when this bill left the House with the amount of money that you claim to be able to recover with waste and fraud. So my question is, how much money on your spreadsheet are you carrying that you plan to recover? And do you plan to recover it from eligibility, or do you plan to recover it by going after and recover money that has already been out?
The gentleman from Washington, Chair Dean M.
Mr. Speaker, Representative Hillstrom, it's $24 million, I believe, that's carried in the spreadsheet, and that is from enhanced verification within the existing resources of the department prospectively.
Discussion. The lady from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker and Representative Dean. Just one final question then from me. And is that consistent with the fiscal note that you got about what the department thought that they could save?
The gentleman will yield. The gentleman from Washington, Chairman
Dean M.
Mr. Speaker, Representative Hillstrom, yes.
The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Would Representative Dean yield to a question?
The gentleman will yield. The lady from Olmsted.
Thank you, Mr. Speaker. Representative Dean, you started out mentioning that you are $302 million below base in this bill, and you've also mentioned that you've spent more in this bill than in the bill that left the House. So I'd like you to tell us if you have the total of how much you're spending in this bill, and then could you please explain how you're able to cut $302 million from base and then still spend a considerable amount of money? I think the body needs to understand where your savings are coming from.
The gentleman from Washington, Chairman Dean M.
Mr. Speaker, Representative Liebling, the bill spends $12,469,284,000. That is off of base, and the reason that that is less is because this portion of the budget, and I don't have the exact percentage, and probably one of my conferees knows what the percent is and will tell me what the revised percent increase is after the conference committee report. But the reason for that is that Health and Human Services and our entitlement programs are growing too fast, and they have been growing too fast for too long, and they are consuming our state budgets, and not just Minnesota, but 49 other state budgets, and they're also really affecting the ability of our state to spend money in areas like K-12, like higher education with Representative Nornis's bill and with other bills that each and every year, as this takes up a larger percentage of our overall budget, it just creates a bigger and bigger problem. So Representative Liebling, the reason that we are saying that is growing so fast is because the base was growing even faster.
The lady from Olmsted, Representative Liebling.
Well, thank you, Mr. Speaker. And if Representative Dean would yield again.
The gentleman will yield. The
Thank
lady
you.
from Olmsted.
Thank you, Mr. Speaker. And Representative Dean, you didn't answer my question. I mean, how much does this bill spend in new money? And how are you able to spend new money when your overall bill comes in $302 million below base? So I don't know if you've totaled it up in the last bill, the one that left the House floor. I had kind of done my back of the envelope calculation that you had spent about $330 million new dollars in that budget when you had, I think, about $1 billion cut target, and we saw then that a lot of it was what we on this side felt was pretty phony budgeting. I think things have been tightened up some, but I'm still wondering, I think the body needs to know how much new money you're spending and where that's coming from when you're getting an overall cut here to the base.
The gentleman from Washington, Chair Dean M.
Mr. Speaker and Representative Liebling, some of that would from the interchange would actually come from savings that we do book within the spreadsheet in our savings area. Some of those we took from the Senate, some of those we took from the House. Also, there's an interchange with the Healthcare Access Fund that was set up in the last, that was began in 2013 and continues some of that. So some of that is actually the interchange with the Healthcare Access Fund, as well as the savings that we took from both the Senate, and I believe we took some savings from the governor as well. That reminds me of the Minnesota Care savings that we did in fact take from the governor's first budget.
The lead from Olmsted, Representative Liebling.
Well, thank you, Mr. Speaker, and I guess it probably is good, members, that it is the middle of the night, because I think Minnesotans should be embarrassed that we have a bill of this size and we have the chair of the committee that put the bill together, and I know we're all tired, but to have this kind of lack of detail, I mean, this has all come together very, very quickly. I suppose that on the one hand we can be proud of that. As Representative Dean mentioned, our wonderful staff has just done magic to get a huge bill like this together in such record time, and all the members have worked very hard, but having a bill like this come together so quickly at the end of a session with barely any time for the public, and really probably not that much time even for the members to understand what's in it, and then to have basically no presentation of it on the floor of the House, I think is really pretty sad. And just to say, I'll just ask questions, and I'm asking questions and we're not getting the answers. I think that we deserve to know where the shifts are and where this money is coming from. And as I look at this bill, I think this bill, although it's considerably better than the bill that left, is still based on a bunch of shifts. And I can understand that. We can, it's a shifty bill. And I can certainly, we can all understand that. We can all. We can all understand when we have a budget deficit. When we have budget deficits, we need to do all kinds of fancy financing, and we've seen that over the years. We saw school shifts, millions and millions of dollars. We've seen all kinds of fancy budgeting in order to get around, to not have to cut very important services to Minnesotans when we've had a deficit. But we don't have a deficit. We have a $2 billion surplus. And I know that everybody likes to say they're impacting the Health and Human Services budget, and I know everybody likes to say they're bending the cost curve and all of that stuff, but I think we deserve to have an explanation of what is actually happening in this budget, because as I'm looking at the spreadsheet, for one thing, members, even though Representative Dean is talking about how, that we're bending the cost curve in Health and Human Services, this bill shows $529 million in the tails. So I don't know that the cost curve is being bent very much here. What we're doing is just shifting some costs, and I certainly would like Representative Dean to talk about that a little bit and explain where those shifts are happening. There are some savings in here. I think there is about $25 million in projected savings, and looking more carefully at eligibility. There are some savings that probably are going to come from our Medicaid program, some administrative cost savings there. So there are some real savings in this bill, and that's good. That's really good. But there are also some fake savings, some things that are just nothing more than shifts, tricks, and gimmicks. And the problem with that is that when we're spending money on very good things, there are very good expenditures in this bill, but we're spending money on things without proper foundation in the bill to have those expenses be supported ongoing. So would Representative Dean yield again?
The gentleman will yield. The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. So I'm just going to ask one more time, Representative Dean, can you explain, first of all, how much new money is being spent in this bill? Can you just tell us that? How much new spending is there? I know there's some very good spending items in here, probably things everyone on this floor would agree with, but how much is being spent on those items?
Gentleman from Washington, Chairman Dean M.
Mr. Speaker and Representative Liebling, it's true that there is new spending. I think that's what you're wanting to look at. What we have is administrative cost savings. One of the cost savings that we didn't bring up was the administrative cost savings from the HMOs. We also have Minnesota Care premium costs sharing at $65 million. New general fund savings included about $100 million in eligibility audits, 25. The administrative efficiencies at $18,200,000. The healthcare access fund surplus at 13, and $10 million in other costs. The continued payment, delayed payment to the HMOs at about 101. Those are the the reductions. We also have additional spending. As you point out, we had some savings that we would have liked to have booked from trying to have people not be on programs that don't belong there, either because they don't qualify for income purposes or they're getting services from another state at the same time, or in the case of Illinois, they had found 10,000 people that were receiving services who in fact were dead, that we thought that that would be a good idea to stop paying for those services in the state of Minnesota as well. And in fact, we were unable to get the folks on the other side to agree to actually any of those outside audits and able to save some more money for the citizens of the state of Minnesota. Yes, where did the money come from? So if we're not saving those dollars and you didn't want to use those saved dollars to spend on programs like the 5% campaign, which we would have thought was probably a pretty good use of dollars, that if we're currently wasting those dollars by paying for services for people who shouldn't be having them in the first place, or services that are being delivered that shouldn't be delivered, or they're not being delivered but being paid for, we could have paid for things like the 5% campaign, which we would have liked to have been able to book those savings and be able to deploy that into a great source of people who are working very, very hard. And in fact, they're probably the most underpaid people in the state of Minnesota, the people who are engaging in high heart services with big-hearted services, but back-breaking services by taking care of folks in their homes and doing some really hard work. So we would have liked to have been able to do that, and we're unable to do that because we couldn't book the savings for a lot of reasons that we've debated a long time on the House floor. So those are some of the things that we would like to have done with those dollars. And where does that money come from? Well, Representative Liebling, it comes from the taxpayers of the state of Minnesota who actually provide the dollars that we spend. I know it's hard to put that together sometimes, but actually that's where these dollars come from. They could have gone back to the citizens either in more services in the case of the 5% campaign. It could have gone to the bottom line so that we could actually save money. And I know that that makes a lot of people nervous when we have actually $1 billion, members, that we have not spent. Now, you would think, for some people, they think, we have $1 billion that we have put in one spot and we've decided not to spend it. You would think that would have just caused the greatest concern in the world. I've never seen so many people so concerned about a pile of money, a $1 billion pile of money unspent. That is evidently the cause for concern around here. That seems a little strange to many of us around here that think it may be prudent to wait a little bit before we spend the money, but goodness gracious, if you got between some of these folks and that pile of money, you better have a hockey helmet on, because from what I see, there is a mad rush to spend that 16 times over with great alarms going on in the background. So Representative Liebling, that's where the money comes from, the taxpayers. There's some of the places that might have gone, places like 5%, also places like the bottom line, or the $1 billion pile of money that's causing so much angst. And the other place it could have gone is back to the taxpayers more immediately, which is probably the preference of most of us on this side.
The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, Representative Dean, I don't know if it's worth asking you any more questions, because you never get an answer. I was reminded of the little debate I heard earlier on the floor when I think one of the members was talking about how every single question gets the answer, gas tax. Well, I think in the Health and Human Services area, I think that it's the same thing. Everything goes back to this made-up money, and I don't want to rehash the old bill. Apparently you do, but you know, I think that you are standing between somebody and a pile of money. You're standing between these very people that the 5% campaign, the people that are doing the home and community-based services. There is a pile of money there. And the reason that they're not getting an increase in this bill, it's not because we didn't take the fake money. It's not because we don't have a big monopoly set with green and yellow and red money in it, and, you know, not green, but all the other colors that are in the monopoly set. You know, it's not because we're not using the fake money. We've got real money. We got real money, and people who need it, people who are delivering really important services to really important people, are not getting any of that in this bill. And they could be. That's a decision. It's a decision that's being made here, and not by DFLers in this House, that's for sure. So I just remember, not that long ago, I remember a speech that was being given about that 5%, about this isn't 5, and this isn't 5, and this isn't 5. Well, this is not 5. This, the big zero, is what that group of people gets in this bill. And this is a different year than when we were in charge, when we put the budget together, because we had a deficit. And things are a little different when you have a deficit. We all know that. You do what you have to do. You try not to hurt people. You get by. You do what you can. But we're not in that situation now. And believe me, I never say that we shouldn't try to save some money and do some reforms. Of course we should. But I see I'm not going to ask any more questions, because I see that just never going to get any answers.
Further discussion. The gentleman from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. I don't believe it's angst about having $1 billion. Personally, I'm just angry that the people in the 5% campaign and the people that work in nursing homes are going to continue to have to worry about how they're going to feed their children. That again, I said it the last time we had this on here, Representative Schomacker's bill in the aging and long term was $200 million, and there was general agreement that that was not enough. Representative Hamilton's not here, but again, the 5% and the 5% was supposed to be just a start, and they're getting zip. I love saving money. My wife will tell you that, but the idea that these people that are working with the disabled and working with the elderly and they can't feed their own kids is just appalling. Vote no.
Discussion to the bill. The lady from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker, and members. There are good things in this bill, and as you've noted, I've commended and thanked those on the conference committee and the staff who helped put together some of those. Many of those are things that we've worked bipartisanly on over the years. And this bill is better than the original House bill, and I'm pleased to say that. But this bill still falls far short of what is needed, and there are still too many left behind. With a $1 billion surplus, we could have done better. We should have done better. And that you proposed as a caucus to have a cut target, and that this bill still represents a cut target when we have a major surplus, shows that these services for people are just a lot less important to you than a lot of other things that you decided to invest that surplus in or to leave on the bottom line. And I don't know how you answer this, but to me the key question is, how many decades is it reasonable for a person with developmental disabilities to wait for the services that will let them be all that they can be, to fulfill their potential? We have 3,500 people with developmental disabilities on waiting lists. Some of them have been there decades. This bill does make some administrative changes to try and move some of them faster off that list, and that's a start. But we would never tolerate the bright kids that we're writing letters to, congratulating them graduating from high school. We'd never tolerate them having to be told, you're going to wait. We're not sure if it's years, decades, how long it's going to be, but that legislature, they're looking out for you. We're hoping next time around we can deal with that. Is a 2.5-year wait for basic sliding fee child care assistance reasonable? That's how long the wait is right now for many families throughout this state. These are our lowest income, highest risk families. They have to earn less than half of the median income, $35,000 for a family of 3, to even qualify. We've done a lot of talking about early childhood. Well, this bill puts an extra $7 million in the conference report, and I'm pleased for that. But that doesn't begin to get us to the $82 million it would take to get those families off the waiting list and into quality care so that they can develop to be all that they can be and get to kindergarten and that pre-K program that the governor's talking about, ready to take advantage of it. It's not right that a pregnant mom can sign up a week after she's given birth, after figuring out how to do that, and have to wait over 2 years, 2.5 years, to get the kind of help that she needs to afford quality care for the child she needs to leave at home while she goes to a low-paying job. But she's out there working, and so is her spouse, and we're not working with them to make sure that that family gets a good start. I agree we need to update and reform our nursing home payment system and grant them increases, and you've really made that a priority and stepped up. But this bill prioritizes those who serve seniors in institutional settings over those who serve seniors in the community, in their own home, in the cheapest place for us to serve them and where they most want to be. We used to treat those alike. You know, we used to realize that whether one helps bathe, dress, or help with the medications for a senior in their own home or in a nursing home, it's the same job. It's the same job. And they're both struggling to get workers to step up for low pay to do work that's emotionally and physically difficult. Most seniors are served in their homes. That's where they want to be. When their needs get too great for that, we need good quality nursing homes with well-paid staff that look out for them. And this bill starts us on that second part of the equation. We can do more on the front. Community services for people with disabilities also allow people to live in their homes or apartments or group homes in a way that's fulfilling and supportive. And yet those people who work for $8 to $11 an hour, they couldn't get a 5% increase. They couldn't get a 2.5% increase. They got 0 and 0. Now, if you were working at a job for $8 or $9 or $10 or $11 an hour, and you knew you weren't going to get a raise for 2 years, and there's a store down the street, a coffee shop down the street that's offering 12 or 13 or more, would you stay? Too many people are making the choice that even though they love working with these clients, they can't afford to do it. There's just really sad stories about the turnover in these people's lives. And these are sometimes the only people who are constants in their lives. And so we need to step up. And I'm so disappointed, and I know you share our disappointment, that these people who work just as hard as you and I do, and sometimes more, couldn't get a pay raise at all in the next 2 years. Left behind also are the responsible people who pay for their nursing home care out of their own checkbooks. Minnesota has a long-standing tradition and law of rate equalization. The rate that the nursing home is paid by the state is the same as the rates that's paid by the person who writes their own check, or their spouse writes that check, or their family writes that check. Equal rates in this bill mean that those who write their own checks are going to see large increases come January of 20 or 30% or more. And I'm really disappointed that you didn't focus on the impact on those citizens and figure out some protections. I think there were some available. Could have been a phase-in. It could have been applying the increase only to the new residents. It could have been another approach. That there's several. We could have had a certain date in which things go into effect. But we needed to have some way to meet the twin goals of helping out our nursing homes and get them the money they need, and look out for the needs of those responsible citizens who are paying for that care with their own checkbook. We're under court order and supervision in so many areas in this area. It's really sad. We have a court judge who's just once again rejected our state plan to finally come into compliance with the U.S. Supreme Court ruling that says people with disabilities have the right to live independently and in integrated settings. It's known as the Olmsted Plan, but it doesn't have anything to do with that county in Minnesota. We have a court order and a court judge looking over our MSOP program. Our St. Peter program, where we've had both staff and patients physically assaulted with some very dangerous and life-debilitating outcomes. In one case, a patient lost his life. We have a conditional license there. And we can't just pick a few winners and let the others depend on the courts. But that seems to be where we're going. And I share your concern about how this budget is growing. And I think there's creative ways to deal with it. But the reality is, as Tom Stinson says, every single one of us grows 365 days older every year. And we have an aging population. We have medical miracles that have kept people alive and doing well with much longer life expectancies than they ever expected, including our own Representative Zerwas, and we are inspired by his story and others who have used modern medicine to extend their lives and to survive. But some survive with significant disabilities that need our help. We also have growing health care costs. I am so pleased that this bill does include the Health Improvement Prevention Program, because that is our best way to reduce our health care costs long term so that we can sustain this budget and all of the other budgets. But we have to prioritize prevention. We have to get our young families off to a good start. We have to make sure that the people with disabilities are treated with respect, and we have to get out from under expensive court orders. I wish I could support this bill, but too many people and too many things are left behind. So I will be voting no, and I hope others will join me.
Gentleman from Ramsey, Representative Lilly.
Thank you, Mr. Speaker and members. Representative Dean, I'm going to ask you real quick. I was kind of looking at your bill here. Is there any tax increases in there, Representative Dean?
Is the gentleman from Ramsey asking the gentleman from Washington to yield?
Mr. Speaker, that is correct. I'm sorry. I would like Representative Dean to yield for a question.
The gentleman will yield. The gentleman from Ramsey.
Thank you, Mr. Speaker. Representative Dean, is there any tax increases in here? I noticed in our last bill we happened to have an opportunity to take a peek at that, and we found a tax increase. And I'd hate to see a couple of your members, being a little bit of quagmire. So I don't know if you have an answer. I didn't read every page.
The gentleman from Washington, Chairman Dean M.
Mr. Speaker, Representative Lilly, what I can tell you is that there's over $12 billion of spending, and that is spending just from the taxpayers of the state of Minnesota. That doesn't include the money that Minnesota and all of the other 49 states send to Washington and comes back to us. So there's actually not quite twice as much money as that spent, but through that. But as you can imagine, over $20 billion of taxpayer dollars are in your hands there. Every one of those dollars is worked for very hard by the taxpayers. I don't believe that there is any tax increases in this bill, but I can tell you that the people who are paying for this are working very hard, and they are working, particularly middle-class Minnesotans, Representative Lilly, are working harder and harder and seeing less and less for that. And many of them are looking at others that are working less and less and getting more and more, and that deal that people are getting with their government is what I think frustrates many of them.
The gentleman from Ramsey, Representative Lilly.
Thank you, Mr. Speaker, and thank you, Mr. Chair. You're right. Taxpayers do work very hard, and we're lucky to have a successful state. You know, just to recap a little bit over the last, to replay over the last couple of years, I don't see Representative Hamilton and Representative Considine kind of mention that, but you know, he used to bring up this 5%. I mean, we heard it like all the time, 5%, 5%, 5%. I mean, some of you newer members, you probably missed it, but he was pretty good at it, and we got the opportunity to hear it, and then lo and behold, you know what happened? The DFL delivered, and we gave 5%, and then in this October we're going to have another 3% coming on nursing homes, and I just. You know, one of the big things in the nursing home part of the bill, Representative Schomacker, I was just wondering if you'd be able to yield, Mr. Chair.
The gentleman from Rock will yield. The gentleman from Ramsey, Representative Lilly.
Mr. Speaker and Representative Schomacker, you know, one of the big things that we were talking about, and I think all of the members in the committee supported your first bill, which was big, and we kind of have a lower number, and I think we all agreed that the employees are important in preserving those, and I'd be curious, you know, in your bill as it sits here, what is the biggest number that a nursing home's going to get in your, and then the lowest number that a nursing home's going to get, Mr. Chair?
The gentleman from Rock, Chairman Schomacker.
Thank you, Mr. Speaker and Representative Lilly. I apologize, I don't have the runs with me right now for your question directly. I do know that we have facilities that do fall under the hold harmless clause in the bill, and so there are a few that are not receiving a rate increase because their rates are already higher than what the median metro rate is. On the high end, I know that we have facilities that were receiving anywhere between 31 and 50%. I remember seeing on there, but I don't have a specific number for you right now, Representative.
The gentleman from Ramsey, Representative Lilly.
Thank you, Mr. Speaker, and Representative Schomacker, Chair Schomacker, I hope you're okay from what you said. Time will heal. Maybe you could rest during the break before the special starts, or however it works. So I was curious if the chair would continue to yield.
The gentleman will yield. The gentleman from Ramsey, Representative Lilly.
Mr. Speaker and Chair Schomacker, so some of you said up to 50%, and then I know some of your members, I kind of went through the list earlier last time I spoke, and some are getting 0, so some are getting 50%. So an example, when you're doing whatever that condition is that you mentioned, so if so when you went through that condition, and then so what impact are we going to see on these employees? Because that's really the bottom line. To be honest, I was a little disappointed last year, and we did the 5% I mentioned, the 3%. But at the end of the day, what we found is the employees ended up not getting as much as we thought they would. So what happens, you know, sadly is, and it really is a big problem out in rural Minnesota, and we heard a lot of it in testimony in committee, of turnover. You know, they might live close to the Rochester area, and they might be able to pick up a job there that pays more in a nursing situation, or they might be in St. Cloud. There's a great article the Tribune had where someone took a job and went and worked for Aldi's that pays much more. So that 50% increase that you have, what is the average? What's that going to mean to an employee? So you're a personal care attendant in one of those facilities. What is that going to mean?
The gentleman from Rock, Chairman Schomacker.
Thank you, Mr. Speaker and Representative Lilly. That answer is going to depend on a lot of different things. As you mentioned, with the rate increases that came in previous years because of the encumbrance that was put on there, we saw a 5% increase added up. I believe testimony was somewhere around 35 cents an hour was the average per hour increase. What we see in this bill is a different approach, because this is actual reform that we're doing here and moving forward, and we're trying to take a different approach that is going to allow us to be sustainable in the future with the route that we're going. And so instead of doing the encumbrance or having a set mark, that's a statewide approach or a one-size-fits-all approach to how these rates are applied to the workers. We instead have language that came from a lot of pressure from amendments that you would offer in committee and from the Senate in trying to work out a solution, and that the rate increase will not go to a facility until they have an agreement with the bargaining unit on just what the, how much of those rates will go directly to the workers. And so they need to have that agreement between the provider, the administrator, and the bargaining unit before we have that. And so it's going to vary from facility to facility greatly on just exactly what that means.
Gentleman from Ramsey, Representative Lilly.
Thank you, Mr. Speaker, and curious if you'd yield for one more question.
The gentleman will yield. Representative Lilly.
Mr. Speaker and Chair Schomacker, so just what's your opinion? Do you think any nursing homes will close in the next couple of years after your bill?
The gentleman from Rock, Chairman Schomacker.
Thank you, Mr. Speaker and Representative Lilly. That's a very good question. Obviously, I can't predict the future, but when we're looking at facilities and we're looking at maybe the past 8 or 10 years, and when facilities were making across the industry in this state about $35 million in profit, and now they're down to less than $8 million in profit a year, and we're seeing today how facilities are being underpaid because of the rates by about $35 to $36 per bed per day. Being able to turn that around and have it be at a level that's actually paying for the cost of care, which this reform takes care of, I think that it decreases incredibly the amount of opportunity for closures in the state.
Gentleman from Ramsey, Representative Lilly.
Thank you, Mr. Speaker, and just it was I think Chair Schomacker had done a good job. I really do feel you have not done enough, but you know, it's not the worst part of this whole bill, certainly, but no, it's you know, these are very important. With the aging, you know, we're all aging. We're aging right now, perhaps, with the night, but that's it.
The gentleman from St. Louis, Representative Metsa.
Well, thank you, Mr. Chair. I wasn't going to speak, but Representative Lilly, you brought up a good point. I was just over in, I guess what we'd call the dog pound, and Representative Dean gave me a gift. I think he was trying to secretly revive a little Bring the 5% campaign back, remarket it this year, and you know, I'm really disappointed that that's actually not in the bill, because it was much needed, and I would say it should be in there, and I'll leave it at that for tonight. It's getting late. So Representative Lilly, thank you for reminding me how important the 5% campaign was.
The gentleman from Hennepin, Leader Thissen.
Thank you, Mr. Speaker. Well, again, members, another missed opportunity with this bill, but you know, people have talked about the fact that we don't have the 5% campaign in this bill, notwithstanding lots of promises to deliver on that. I think it is interesting to note that the tails from our budget 2 years ago for the for the upcoming biennium that you're budgeting for right now are actually about 3 times as big in terms of investment in long-term care as the money you're putting into long-term care. And the investment we made with a budget deficit last year of $625 million plus an $800 million school shift to repay, we actually invested more in long-term care than you are investing in this bill, with a $2 billion surplus. Another missed opportunity. You're taking money out of the pockets of hardworking Minnesotans, the thing you say you hate to do the most, by raising the premiums and the out-of-pocket costs for people on Minnesota Care. Increases that are likely not going to be affordable to them. And again, in a time of a $2 billion budget surplus and a time when the Healthcare Access Fund actually had sufficient money to cover those costs without making those changes. I do note that you're spending about nearly $12 million on MNsure, to additional dollars on MNsure in this bill. Something I don't think that was your intent to begin with. But the main thing I want to touch on is something that Representative Schomacker said, talking about sustainability. Representative Schomacker, will you yield for a question?
The gentleman from Rock will yield. Gentleman from Hennepin, Leader Thissen.
Are there any limits on the cost-based increases in your bill? Is there any limits on how big those jumps could be year to year? Assuming, say costs go up 10%, are we going to be on the hook for a 10% increase?
The gentleman from Rock, Chairman Schomacker.
Thank you, Mr. Speaker and Representative Thissen. There are limits. First, we work on the median amount, and so it has to, the entire state and the region around a facility, the median is the amount that it actually goes up, and so the direct cost of care gets placed into the median calculation, and so those that are on the extreme levels are not going to be a part of that, as well as there is also audits that are taking place every other year. I believe the bill has some staffing for extra people to take care of some of the audits that would be at the facilities to make sure that these cost reports are accurate and help make sure that they're getting the best value in their spending.
The gentleman from Hennepin, Leader Thissen.
Thank you, Mr. Speaker. Well, I think what you just heard is we're essentially putting the spending for this program on autopilot, and whatever costs get incurred by nursing homes are going to be the increase that we have to pay without particularly any review or caps or controls by us. And as Representative Loeffler pointed out, not only are those increases uncapped, and remember, this is a growing population. So this reform you're putting in place actually has the potential to grow our cost of long-term care significantly more than we have in the past. And for those people that are private pay, they're going to see those significant costs coming right out of their own pockets as they go out. So for the consumers of the nursing homes, you're going to see significant increases for those families. They're going to be paying much, much more for those long-term care services in nursing homes than they ever paid before under the bill you're passing. And it's going to be done in a way over which they have no control, because it's going to be the costs incurred by the institutions that's without any limitation going to drive the money coming out of their pockets. That's the reform you're putting in place. And in terms of sustainability outside that program, you're saying that this is a 325 or some, I don't know, $300 and some million cut, partly paid by that tax increase you just voted for in the last bill, in the K-12 education bill. And again, a lot of those costs are because we're shifting money from one fund to another. You're passing the biggest budget in the history of the state by far, a $42 billion budget, and that's an undeniable fact. And in this bill, if you look out to the next biennium, you're increasing the tails for this budget area by over another $500 million. And if you look out probably 2 years beyond that, you're increasing the tails in this budget by over $1 billion. So for all the fiscal conservatives over there who are relying on the funny money in this current biennium to claim that you're doing some kind of cut in this budget area, you are exploding this budget into the future. That's the bill that you're passing. And I know that based on the tax bill that you passed off the floor a couple of weeks ago, you don't really care about the tails because that had incredibly huge tails as well that would have sent us into an immediate deficit. You're doing the same thing in this budget. So members, again, we're missing a big opportunity. You're spending boatloads of money, but you're doing it in a way that's actually getting less money to long-term care than we were able to do with a $625 million budget deficit. You're taking money out of the pockets of the poorest working people in this state, and you're only doing it this way so that you can preserve that $1 billion. And Representative Dean, you might want to talk about, that you want to think about what you want to do with that money. Well, we know exactly what you want to do with that money. It's no illusion. You want to pay for the tax cuts, and the speakers, the current speaker, I don't know what you call you, the speaker, Chair Davids.
The pretend speaker.
The pretend speaker. For the tax bill that he wants to give to the owners of skyscrapers and the Mall of America and all these folks. The $1 billion is sitting there. You're saving that money, and you're doing all these budget pretzel twisting around in order to save the money so that next year, can't do it this year, next year you can give those big tax cuts to corporations. So members, again, a huge missed opportunity for us. Reforms that are actually going to create unsustainable growth in these budget areas, and over $500 million in tails. So exploding the Health and Human Services budget that you say you want to cut. That's what you're voting for in this bill. And you're doing it, notwithstanding all of that, you're not actually able to fund one of your top priorities, which is the 5% campaign. So members, I would encourage a no vote on the bill. We can go back and maybe start over with a more honest budget and a budget that's actually going to move our state in the direction of actually taking care of people.
The gentleman from Washington, Chairman Dean M.
Thank you, Mr. Speaker, and Representative Leader Thissen. I just want to take this opportunity to thank Representative Schomacker and all of the work that he has done in his committee, the members of his committee, for really putting together a generation in the waiting reform in our nursing homes. It is expensive down the road. It's expensive this year and down the road to fund our nursing homes. And it's expensive because it's people taking care of other people, people with dementia, people who are frail and elderly are very expensive to take care of. They take a lot of care. And if you look at the costs and the drivers in Health and Human Services, it's not the unbelievable technology that you might see at the Mayo Clinic or the University of Minnesota, but it's one person taking care of another person all across the state of Minnesota. Just in Alzheimer's is $217 billion per year nationally. Representative Keel has a really good bill that really aims at getting dementia research in the state of Minnesota. So I want to particularly thank the Committee on Aging for their work, and really a generation in the waiting reform to try to make it a little bit more fair for our nursing homes across the state of Minnesota. We talked about Representative Marquardt's nursing homes in his area, and I hope that they're able to stay open, and they will be, I believe, with the help of Representative Schumacker's bill, to get the help that they need to keep the doors open. It is expensive and it will take some money down the road, and we believe that that is a priority that should be funded within the means that we have. And the Senate chose not to fund the 5% campaign. The governor chose not to fund the 5% campaign. It's very difficult in that environment to move forward, but it is a priority of our caucus. So when I hear talk from the other side of the aisle about wanting to prevent tax increases, Representative Lancheski, Representative Thissen, and others, that's great. If y'all hear you say that you want to keep the tails down and watch the tail spending, that is encouraging news to hear from the other side of the aisle. It means, and I also like the idea of overall spending, trying to keep that down. So I'm very encouraged by what I'm hearing from the other side of the aisle about wanting to keep our tails number down, wanting to keep overall spending down, wanting to cut taxes. Really being in the minority gives you more time, and I think we're getting through to you. I'm really strongly encouraged by what I'm hearing from the other side of the aisle this morning, and so I think that's good news for the years and the months ahead. And with that, Mr. Speaker, I'd ask for a roll call.
Roll call having been requested. Are there 15 hands? Seeing 15 hands, there will be a roll call. Further discussion. The clerk will take the roll. The clerk will close the roll. There being 86 ayes and 43 nays, the motion prevails. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File Number 1458, as amended by conference.
Discussion to the bill. Representative Zerwas.
Well, thank you, Mr. Speaker, Mr. Members. I tell you what, we're gonna, I know it's early, but buckle up, strap in, put on your helmet. We're gonna turn on the Wayback Machine, and we're gonna go back and look at all the things that you didn't fund when you raised taxes by $2 billion. We hear about the stuff in this bill that we like, and it's some good changes. We have MAEPD, which was cut when there was a significant deficit. Last time around, $2 billion in new taxes. We didn't fix it. You didn't fix it. MA spend down. There are members in this body on your side and our side that have worked on MA spend down reform for session after session after session. You raised taxes by $2 billion. You didn't address it. MA dental reimbursement. There are members both here and in the Senate, and I've been here for a long time. 50th out of 50. You guys raised taxes by $2 billion. You didn't address it. So, before we start getting too worked up, let's focus on how much good stuff is in this bill. Because this is a bill, and I know we got some members that decided that they could maybe support this bill. I think it's time to take a pause and really think about what's in this bill, because trust me, you're going to want to vote for this one. This is a good bill. I want to thank my conferees on the House side, and also the cooperation and the sentiment with the conferees that we had in the Senate. Senator Laurie, I think, and Chair Laurie and Chair Dean put together a good bill, a bill that we can be proud to support. In this bill, the ABLE Act, a bipartisan bill that's state enabling legislation of federal legislation that was spearheaded by Amy Klobuchar. That's in this bill. It's a good bill. It helps families with children with medical disabilities. The rural dental MA rate increase, significant dental shortage in greater Minnesota. This bill will significantly raise the MA reimbursement rate for dental patients in greater Minnesota. A huge victory for greater Minnesota. MA spend down. Right now, we tell people on MA, if you're disabled, if you make $1 over the federal poverty guideline, you have to spend down to 75%. You have to spend into poverty. For the first time, we've moved that up to allow people to keep more of the money that they've earned. That's a good thing, members. That's a really good thing. $52 million for child protection, with a minimum, a base of $75,000 going to each and every county, and then going up from there. We heard in committee of 50 children that died over the last several years. This bill addresses child protection, $52 million. Huge investment in child protection. And I want to thank Representative Krisha for his work on that. We have a significant progress in mental health, in our mental health system. It really prioritizes helping out people in mental health. There is a pilot project in here for Beltrami County, Representative Hancock's bill, that says we shouldn't treat mental health patients like criminals. And there's a jail diversion program funded for Beltrami County and their surrounding counties that are having a terrible problem out there because there aren't resources around them. This bill addresses that in greater Minnesota. We talked about SHIP. We keep SHIP at $35 million, the base spending, but we are expanding what SHIP is focusing on to look at dementia and elder care. Huge cost drivers, and we're adding in a study for the department to demonstrate the return on investment of SHIP. We have over $3 million in this bill going to homelessness across the state. This is a great way to use that money. We have $5 million, a Representative Backer bill, $5 million for critical access hospitals. Again, we're focusing in rural Minnesota and really helping out these hospitals. That's a great provision. It's one that we should be proud to support. We talked about the basic sliding fee. This bill adds $10 million to the basic sliding fee. We're making progress. I would be remiss if I didn't mention the Thissen-Zerwas nursing home rate construction bill. I want to thank the minority leader for his work there. Members, this is a really good bill. And I know that you are concerned about the impact on the increased for co-payments for Minnesota Care. I was kind of surprised that the governor insisted on putting that in his budget, and the Senate Democrats insisted on putting that on their budget, and then insisted that we take it as a part of the compromise. I was surprised that the Democrats forced that onto the conference, but we're all about compromise, members. So the Republican conferees accepted that provision. This is a great bill. It is going to help many Minnesotans. I urge a green vote.
The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And members, make no mistake about it. There are many wonderful spending items in this bill, no question. And in a year when we have a $2 billion budget surplus, I don't know how anyone could justify not taking care of some of these very important needs that Representative Zerwas has alluded to. But I do want to answer kind of specifically some of the things that he brought up. First of all, he talked about the MAEPD. This is the program that allows people with disabilities to pay a premium and be able to tap our medical assistance program to get some of the health care and services that they need in order to be able to keep working and supporting themselves. And he alluded to the fact that kind of chastising the DFL about not doing enough, but this was cut by the GOP. These premiums were raised by the GOP. And this was done, again, when the GOP was in charge, both bodies, and had a huge cut target in health and human services, and did a lot of things to cut the growth of spending in health and human services and so on, and people got hurt. And yeah, we the DFL didn't fix everything. There are still a lot of needs. But I'm really glad to see, well, Representative Dean mentioned he's glad to see that we're concerned about saving taxpayer money, and we are. We always have been. I'm really glad to see this year that Republicans understand the needs of the state and understand that health and human services, that you gotta spend money to get services for people. Representative Dean said that the frail and elderly are expensive. They are. That's the problem in this budget area. It is a growing budget area. And the problem is you can't get rid of those costs just by pretending they're not there. So your budget, this budget that is before us, I think it spends about $500 million new dollars. I haven't really had time to add it up. I was hoping that Representative Dean would be able to give me that number. He didn't want to do it or didn't know that number. There is a lot of new spending. So great. It's from our part, it's wonderful to see those needs met. It is wonderful, with some exceptions. I do want to mention the Minnesota Care premiums that Representative Zerwas talked about, and the fact that those premiums, the governor in his original budget did have some savings from that. He raised those premiums, and there was a reason, and that was because at that time, the Healthcare Access Fund, which is the fund that supports that program, was showing a deficit. So he put together a budget reflecting the deficit situation that was there. But then when the February forecast came out and that deficit was no longer showing, he removed that cut to those people. So again, this goes back to what I was saying before. When you have a deficit, there are things you have to do. You do what you have to do. And the governor did that, but when he saw there was no longer a deficit, he removed that cut to those folks on our Minnesota Care program. So I don't think you can, it's quite fair to say, oh, the governor was doing this and we're just doing the same thing. That's just not the case. And Representative Zerwas, you who care so much about dental care, and I know you do, and I'm delighted that your dental care reimbursements are being raised in this bill, part of the new spending, right? Hope you're brushing and flossing, in addition to drinking all that pop. But when you cut the Minnesota Care program, when you, in your budget that you passed, that you voted for, were willing to eliminate the Minnesota Care program and put it on MNsure and do some other replacement, you were cutting the dental benefit. Not just reducing their access, but cutting their access altogether. So there's no purity in that for you, Representative Zerwas. I'm sorry. You know, that what it comes down to is you can't get services for people without spending money. That's really the reality that we're dealing with. But members, the problem with this budget, again, is this budget, it's like it ignores the laws of physics. It ignores the laws of finance. Where this budget is getting its money to do that extra spending is by taking the money out of the Healthcare Access Fund and using it to buy stuff in the general fund. And as Representative Dean has told us so many times, that fund right now, it's going away. So you're just doing a shift. You're borrowing time. You're taking money that's really for a different purpose, and you're using it to be able to buy stuff that you want to buy, because it is very hard to say no to people in Minnesota who really do have very serious needs. We all want to meet them. We're all human beings, and when somebody's in front of you, it's pretty hard to say no. And that's what's going on here, members. So great budget. It would be a great budget if it was supported by real and ongoing money, but it isn't. That's the problem with this budget. So I want to address a couple of things. Representative Lilly asked Representative Dean whether there are tax increases in this. Well, there are. There are tax increases, the same kind of tax increases that are in the higher ed budget that Representative Pawlowski talked about. When you increase costs to somebody, like increasing student tuition, that is a tax on those students. In this budget, there is a tax on people in nursing homes who pay their own way. And they're not necessarily wealthy people, they're just people who are middle-class people who have saved up, who have retirement funds, who have some kind of assets. They don't qualify for Minnesota Care. They go in a nursing facility and they're spending their own money, and it's very, very expensive. And what happens under this budget, under Representative Schomacker's wonderful new reform, which is wonderful, and I'm glad he's doing it, but it leaves a big gap. It imposes a very large tax on people who are paying their own way in nursing facilities. And Representative Loeffler explained a little bit why that's happening, but I wonder if Representative Schomacker would yield to a question.
The gentleman from Rock will yield. The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Representative Schomacker, isn't it true that some of the nursing homes will get as much as a 40% increase in their rates under your provision?
The gentleman from Rock, Chairman Schomacker.
Thank you, Mr. Speaker. Yes.
The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And members, if you have a nursing home in your district and they're going to get a 40% increase under this bill, I'm sure you're very happy about it. But if your grandmother is in that nursing home and she's paying her own way, using her hard-earned assets to pay her own way in that nursing home, she's getting a 40% increase in her rate. And that's why I'm saying there's a tax. You are raising taxes in this bill on people who have scrimped and saved to get some assets together for their retirement. Those people are going to pay more, and in many cases a lot more. In some cases 40% more for the exact same care. So that's something to be very concerned about, and I would say a pretty good reason to vote no on this bill. Some of you may remember something called the granny tax. In about, I don't know, it was before I was elected, somewhere back around 2002, the legislature decided to put a surcharge on this same group of people, the people who pay their own way in the nursing homes, and there was some kind of fancy financing where it got a match from the federal government. It was a nice way to raise money. Well, the response from the people who had to pay that tax was not too happy. They felt it was very, very unfair. This is a vulnerable group of people. They're paying tremendously high rates to be in a nursing home, and you're raising them by up to 40%. I also want to mention something else that Representative Lilly brought up. He talked about an increase for nursing homes that the DFL had passed. And I just want to make sure that you know, Representative Lilly and others, that that is being repealed in this bill. It was supposed to go into effect. I'm sure Representative Schomacker will correct me if I'm wrong. Maybe something's changed. But we had a bump. We had a more gradual increases. And one of them was supposed to go into effect, I believe, in October, and that is being repealed in this bill. So with that, members, I know the hour is late or early, and I think there are many important things in this bill. Oh, before I end, I do want to mention, how could I forget, one thing that is a real reform that is in this bill, and it's one that I worked on with Representative Schultz and Senator Benson, and something that doesn't book savings, but that should give us savings into the future. And that is, we got a report from the Office of the Legislative Auditor back in March. It has to do with auditing the HMOs, to whom we pay billions of dollars every year to deliver this health care. And we have in this bill, although I won't be voting for it, we have in this bill a reform that is going to clamp down on some of the things that they pay for, that we pay for, like some marketing and some other things that they have been spending our money on that I think nobody in this body would think was correct, that we should be, things that we should not be paying for. So there are reforms that we can do. I hope that this was worked on, I think, across the aisle. I'm very proud to have worked on that with Representative Schultz, with Senator Benson, and that this is part of this conference report. And I think that there are other reforms that we can work on across the aisle, that we can be serious about trying to save money, about trying to deliver care in a better way that's more efficient, about keeping people healthier through SHIP and other ways that save money. But this bill is still built on shifts tricks, and gimmicks, and I urge members to vote no.
Further discussion? Further discussion? There being no further, the gentleman from Washington, Chair Dean M.
Well, thank you, Mr. Speaker and members. We do appreciate that, and thank you, Representative Liebling, for pointing out a few things. And also, I want to thank you for the work that you had put in on some of the MCO audits and other things on the committee. Do appreciate that, and also want to once again just sort of recognize the fact that you're going to be voting against the bill, Representative Liebling, that you just talked about with many of the good things, and I'm wondering if Representative Liebling might yield for a question.
She will yield. Representative Dean M.
Representative Liebling, could you point out in the spreadsheet or in the bill where you see a shift or a gimmick?
The lady from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Representative Dean, it's a very long spreadsheet, and I'd have to look through, but there is a shift from the Healthcare Access Fund. There is a delay in payment to the HMOs of $135 million. I believe you mentioned it yourself. It just moves it from, it's just a shift that moves the payments, that you can count that as a saving. But the main one is this shifting from the Healthcare Access Fund into the general fund. But it is quite a long spreadsheet, and I'd have to sit here and look through it to find where those items are.
The gentleman from Washington, Chairman Dean M.
Well, thank you, Mr. Speaker and Representative Liebling. I think you got the gist of it there pretty well. The payment delay to the healthcare organizations is, in fact, a continuation of what we currently have, which was signed into law by Governor Dayton in 2011, that you could have chosen to reverse or pull back, which you did not in the last session, and that's a decision that was made. We're going to continue that delay. The folks that are going to be receiving that, we have about $10 billion in Medicaid funds that flow through mainly through our nonprofit HMOs in the state of Minnesota that manage our care, and we believe that they need to not only participate in some savings, but also return some of that money back. We would have liked to have seen more savings, particularly in the area of waste, fraud, and abuse. But that is one area that's for certain. Representative Liebling, and we would acknowledge that, and also want to acknowledge the fact that that was, of course, a continuation of what we had. Secondarily, Representative Liebling, you also brought up the fact that we are looking at the Healthcare Access Fund. And if you remember, in the last biennium, we had a change from the way we used to spend money out of the Healthcare Access Fund to a new way. That was in Representative Huntley's bill that allowed that to be spent on Medicaid, which is basically what Minnesota Care used to be. Minnesota Care is now, for my family, would go up to about $56,000 per year. As more and more becoming a middle-class delivery system. Medicaid system from before is up to 133%. That shift, Representative Liebling, is basically covering the cost that the federal government is underpaying us in our Minnesota Care program. And again, we are not, that is not sustainable, and we are having to bail out the federal government. That began in the last biennium in the budget. And had we not done that, Representative Liebling, we would actually have had a tax decrease because the Healthcare Access Fund would have had a balance that would have, in fact, cut taxes. By shifting that, you raised taxes in the last biennium. So I want to just acknowledge that the two pieces that you did bring up were, in fact, existing law. We would have liked to have seen more savings in that, in the budget, Representative Liebling, no question about it. But I did want to acknowledge and just point out the fact that the things that you point out were the ones that you had voted for in the past and we currently have. Also, I want to just point out in the last vote, I was looking at the votes and I was a little bit puzzled and surprised by some of the votes, particularly when I look at the nursing homes, because that is such a big priority that we have in the state of Minnesota. Representative Anzels, I think I want to thank you for your support, and I think the people of your district probably would too. You've got $3 million to District 5B in nursing homes that are going out. But then again, right around you, I see I'm a little bit perplexed. Representative Metsa at $4.184 million in nursing home payments to your district. I also see that Representative Marquardt, I just scratch my head, Representative Marquardt, $3.753 million to the nursing homes in your district. Rural access dental to the folks that are trying to provide dental care to kids in your district, increased dental access for folks in your district, the nursing home increases for folks in your district. Rural Minnesota really does well under this bill, and I can tell you that from a guy who can, and hopefully shortly will be able to go home and take a nap, will be in my own bed in 20 minutes. So this is not affecting me. And I can tell you that I just scratch my head, Representative Marquardt, when I think about the folks in your district and all of the good things that this will be doing for them. I can't believe you didn't support the bill. And it's not just folks in greater Minnesota, and when I think about the nursing homes, it's also folks that are closer to home. Representative Carlson, $7.5 million to the nursing homes in your district, Representative Carlson. $7.5 million. I can tell you that Representative Freiberg, $4.25 million to the nursing homes in your district. Representative Thissen, $6.9 million to the nursing homes in your district. So this is not just helping rural Minnesota nursing homes, this is also helping nursing homes all across the state of Minnesota keep their doors open. And this is not for whiz-bang, fancy new machines. This is for people taking care of other people and trying to keep the doors open. And so I want to thank again Representative Schomacker for his work in this bill. When I think about the people who are not supporting this bill and who voted no, I just scratch my head and I think, what are you thinking when you think about what we're doing for vulnerable kids in your district across the state of Minnesota? With Representative Creech's bill to really protect children across the state, I really kind of scratch my head and wonder about that. And I also look at how this is not a good thing for your district. So I'm thinking you probably didn't read the bill, and I hope that you do, and I hope you appreciate the good things that will happen. And I also hope that the governor will sign the bill and get these dollars flowing to the folks who really are going to benefit from this, the people who are going to be receiving the care, and the good folks, the good-hearted folks who take care of them across the state. I just once again want to thank all the folks who worked really hard on this bill, the staff members as well, the conferees, and the members. So once again, thank you very much. Appreciate your vote.
Any further discussion? The clerk will take the roll. Members, please vote. Clerk will close the roll. There being 99 ayes and 31 nays, the bill is repassed as amended by conference and its title agreed to.